Thank you for taking the time to watch this short video to learn more about children and young people's speech and language therapy service in North Ayrshire. This video will share information about what our service can offer and will signpost you to further information and support. Learning to communicate is a complex process. People often don't realise that there are many different skills involved in becoming an effective and confident communicator.
Let's have a look at the communication pyramid, which shows us all of the skills involved in communication. The communication pyramid shows us the building blocks of communication. In order for successful communication, the right foundations need to be in place. We often talk about the tip of the iceberg. These are things that we can see or are the most obvious, such as how many words a child uses or how clear their speech is. However, we often need to think about the other communication skills in the pyramid first. For example, you might be worried that your child isn't talking yet, but it's important to think about the other aspects of the pyramid too. Is your child able to sit with you and listen and pay attention to a shared activity? Developing this skill might be a priority before we focus on helping them to use words or to express themselves. Pause and have a think about your child's skills at each level of the pyramid.
What does speech and language therapy mean to you? We will now take a look at all of the different ways in which speech and language therapy services can offer support to your child, your family, and those around your child. True or false? A speech and language therapist will see your child every week in clinic to fix their communication difficulties. False. A speech and language therapist does lots of different things depending on your child's needs.
Sometimes it is appropriate to see your child for weekly one-to-one therapy. This is what we do for some children, for example, if they're working on a specific speech sound or language target, but it's not what every child needs. We might complete assessment with your child and talk to you about their communication strengths and challenges. We might help you and your child to use other ways to support communication, such as using Makaton signing or visual supports. We often work closely with schools and nurseries to make sure that the people around your child know how to help them communicate to the best of their ability. This might be discussing advice and strategies, offering specific training, and observing how your child communicates in school. We offer lots of different trainings and share messages with the wider community to help people better understand and support communication needs. Our role is to help make sure your child is communicating to the best of their abilities and to help you and those around your child to understand how best to support their communication. To help you communicate with your child, support from the Speech and Language Therapy Service is available in lots of different ways. We offer a weekly helpline and drop-in service, both virtually and in person, where you can access support and advice.
Not all children's communication will develop in the same way. For lots of children, the most important thing is that the people around them know how best to communicate with them to help them reach their full potential. Speech and language therapy can help you to understand how your child communicates and what things you can do to support them. We might talk with you about neurodiversity. Neurodiversity describes people whose brains work differently. This means they have different strengths and challenges from people whose brains don't have those differences. This might include those who are autistic, those with a learning disability, or those with developmental language disorder. Communication may develop differently or look different for children who are neurodivergent. Some might use various methods of communication, including signing, pictures, or electronic devices. Others may use verbal language, but this might develop slightly differently than expected.
Speech and language therapy isn't about trying to fix communication differences. Often the most important thing is to understand how you can change your communication to suit the needs of your child and knowing how to adapt the environment around them. Speech and language therapy will help you and those closest to your child to put these things in place. We aim to help you to feel confident in supporting their communication once speech and language therapy are no longer involved. Here are some links to some further helpful information.
If you have a concern about a child's communication, there are a number of different ways to get in touch with the Speech and Language Therapy Service for support and advice. Our helpline is open every Wednesday afternoon between 1 and 4 p.m. We also offer a virtual or in-person drop-in service. To book a drop-in, please text the helpline number with your name and email address and we will contact you with an appointment. Our helpline and drop-in service can be accessed without having to complete a referral or be on our waiting list. Many children could be supported to reach their communication potential without having to be referred to the Speech and Language Therapy Service.
If your child is autistic or has social communication differences, we also offer a virtual drop-in appointment with a specialist speech and language therapist and an occupational therapist for specific advice around communication and activities of daily living. Details of how to book an appointment are on screen. To book your social communication drop-in appointment, please email us at spin@aapct.scot.nhs.uk. You can find us on the NHS Ayrshire and Arran website by searching NHS Ayrshire and Arran Speech and Language Therapy. Thank you for watching.